Hello and welcome to Hot Mama's Cool Planet, the sustainable wellness podcast where two hot lifelong friends, Mur in bustling London town and Miechie in sunny California, talk about self-care, sustainable living, and the gloriously messy middle of life, sometimes with a little ranting along the way. And today we are so excited because we have a guest with us who is Dr. Jill Klayman, who's going to talk about insomnia with us. And she also happens to be Mur's sister.
Yes. My
and
sister.
And we will introduce her more later. But before we will do our little ritual of sharing a tiny pleasure that we had this week. So since I'm already talking, I'll go first. I have been doing a lot of after parties around the Game Developer Conference in San Francisco. And I'll talk more about that in next week's episode. But I had a tiny pleasure last week because I had like one with just family and friends here in town in Davis last night. And my son, Manga Monster, who's 11 years old, first some of the kids came over and he was all kind of shy and just reading in his room and not interacting with them. And I'm like, oh, should I force him to be a better host or what should I do? And but then by the end of the night, he was just, everyone was playing with each other. And I'm like, oh, okay, is still at an age where he can interact with the opposite gender and not be totally awkward. And he had a good time. And so the kids had a good time and the grown-ups had a good time. And that was my like tiny moment of pleasure when I peeked my head in the room and they were playing darts and whatnot.
That's
so yeah,
good. That's nice to peek in on. Everybody's happy. I'll go next. My tiny pleasure was that the hairy guy every few months makes my favorite recipe, or one of my favorite recipes of his. He's a really good chef. He's definitely a better chef than me, even though I don't know, we probably cook about the same amount of time. But so one of my favorite recipes, he made pozole, and it's vegetarian pozole. So normally that is made with like pork, but I don't know, he found some recipe where it's like a bunch of pinto beans and the hominy, which is like gigantic corn. And I don't know what he flavors it up with, but he like roasts or toasts some chili peppers, and it makes it so that the air, if you go through these clouds of like toxic, and it's like, I got it in my throat, which doesn't sound like part of the tiny pleasure, but then you get to eat the soup, the actual, and you put like cilantro, or as we say here in Britain, coriander, and you put like avocado on it and maybe some crunched up tortilla chips, and it's just my favorite meal, and he makes it every few months, and that was my tiny pleasure this week.
Having Mexican food when you're far away from Mexico is such a pleasure, and especially something like pozole, a vegetarian version of it, sounds so good.
It's yummy. I highly recommend. All right, Jill, what was your tiny pleasure this week?
My tiny pleasure is still happening. My youngest child, who is away in college, is home for spring break.
Yay!
So she arrived last night. So yay!
Woohoo!
Nice.
Awesome. So our loyal listeners, you just met Dr. Jill Klayman, who happens to be my big sister, and she is not only a fabulous human who I am happy to say that I've known my entire life, but she's also a brilliant psychologist with over 30 years experience in clinical health psychology. She works with a veteran population, and she's embedded in a primary care team. She has a specialization in pain management, and then with the veteran population having a lot of stress-related issues, you get pain and stress together, and what's going to often overlap with that, but sleep issues. So Jill has, along the way, developed a lot of special experience and ways to deal with insomnia, and that is going to be the topic for today's program. So Jill, thank you for joining us.
Be here.
Yeah. Do you want to? Did I get the intro right? Is there anything I left out?
No, that is perfect.
Cool. So tell us how you started, getting more and more interest in insomnia.
Yeah, well, when people are in pain, they change their behavior a lot. And so they become less active and they're hurting all the time and they're just not worn out at night. And even if they are, they're uncomfortable in the bed. And so sleep was just almost always a problem for the folks that I worked with who had chronic pain. But then I moved into primary care where I just see, general people who are coming in for their annual visit and or who have, problems that you don't think would affect sleep. And guess what? Sleep is affected for them too. Like really for everybody, at least at some point in our life, we're going to have some sleep issues. So it just became something that I've become real passionate about. I always ask my patients how they sleep and and if they want to prioritize that, then we absolutely do.
Huh.
I'm
So,
so excited to learn about today's episode. I think insomnia is so important for mental health. In
Absolutely.
my own mental health journey, I have found that sleep hygiene is super, super important. And I'm just so curious to hear your insights about that today. So, yeah, I just wanted to pitch in that I'm really
yeah.
excited
Yeah,
Yeah,
to
and
learn
it
about
gets
this today.
harder as we get older. So here we are all, women of a certain age. We're just not as resilient. Like, I said my college age kid was here. I mean, she can sleep with noise, with light. And she sleeps, a phenomenal amount of hours. I'm so jealous, but I'm not going to ever get that kind of sleep again. And sorry
huh.
for you.
Yeah. Well, I guess to start, can you tell me, you know, let's just top 10, top 5, what are the things you tell your patients when they come to you and tell you that they're struggling with sleep?
Oh my goodness. Well, the first, probably most important thing is that the more you freak out about the fact that you're not sleeping, the harder it is to sleep. So,
Oh, how do you not freak out?
right. So like everybody is going to have times in their life when they can't sleep. And if you sort of assume that that's normal, then when it happens, it's just so much easier to cope with. Whereas if you're like, oh no, I'm not getting enough sleep, how am I going to function in the morning? Or, like, what if I don't sleep again tonight? That
Hmm.
kind of thing. It's so much worse. So, like, a lot of what I do is just sort of normalizing insomnia. I mean, like, who hasn't had a rough night of sleep, before a big test or a presentation or even going on vacation, which is exciting, right?
Definitely.
Much less if you have, kids or parents that you're a caretaker for, or you're feeling sick, or you have pain or whatever. I mean, of course, it's going to affect sleep.
Hmm. I mean, I've had, the occasional night like what you're describing of insomnia, but when I was suffering with frozen shoulder, which I've spoken about on this podcast before, and basically for 6 whole months, I was in so much pain and like worse at night, I couldn't sleep, and like insomnia night after night, chronically like that for months on end. I mean, I was not functioning. How do you deal with somebody who's in that kind of situation? God, I was grateful when it was over.
Yeah, right. Most most people, um, will have chunks of time when they can't sleep. But then what happens is they'll respond in a way that perpetuates not sleeping.
Mm,
So even when that thing is gone, or with chronic pain, it's not so much that you ever expect it to be gone, but
mm,
like we kind of get used to a
yeah.
certain amount, and
Hmm.
that like we've become a little bit more habituated to it.
Hmm.
What happens with those folks is they tend to have like perpetuating factors where their insomnia is maintained. So, like, let's say you had a horrible night's sleep, and so you decide, well, I'm just going to take a nap, or I'm going to linger in bed, I'm going to go to sleep earlier to try to catch up. Like all of that messes up your circadian rhythm. It messes up like like how hungry you're going to be for sleep at your normal bedtime, and then that adds to the problem. And so usually for folks who have like chronic insomnia, we're kind of addressing the perpetuating factors. We're addressing like, how do you respond to insomnia in a way that makes things even worse?
I see. So first you normalize it and you tell them don't freak out if it's just a once in a while kind of thing. And then if it's a chronic kind of a thing, you're like, don't fall into all these bad habits.
Exactly. And usually, like when I work with folks on sleep, I mean, they usually respond really quickly. So I really like treating sleep because like 4 to 6 sessions and they're feeling so much better. And and then they know what to do next time or to avoid next time, right? Because it'll happen again because we're going to get insomnia over and over again. That's just part of being human.
So 4 to 6 sessions is longer than one podcast, but maybe but maybe you can tell us like what would be like a top tip you're telling somebody who's maybe on their second or third night of a bad night of sleep.
So, so there's a couple of strategies that I probably highlight. One is that you want to be pretty strict with your sleep schedule, that you don't want to get sloppy with it because your circadian rhythm is very complicated, and you want to keep it going on a nice even keel. So if it stays strong, when the stressor ends, when you're feeling better, sleep should just go right back into place. But even if that's going to persist, right, having a nice strong circadian rhythm it's important for health in general. Like circadian rhythm deals with more than just sleep. So you
Yeah.
want to have a nice consistent schedule, and you don't want to sleep outside of your sleep window. So, let's say you decided you want to wake up at 8 o'clock every day. You want to wake up at 8 o'clock every day, whether you got 2 hours of sleep, 4 hours of sleep, or all eight, right?
Ah.
Or and you don't want to go to bed at an unreasonably early time, right? I mean, most people need 7 to 9 hours of sleep. So I mean, if you had an 8 o'clock wake up time, bedtime at midnight is perfectly reasonable,
So
for
would you tell
sure.
these people with their schedule like, always go to bed at midnight? What happens, what should they do on the night when they've been out late and now
Right,
they
right.
find
So you
it's 2
still wake up at
a.m.?
8. So waking up at the same time is really more important than going to sleep at the same time because sometimes you might not be tired at midnight. Why would you
Yeah.
want to lay in bed feeling frustrated, right?
Yeah.
So that kind of is the second bit of advice. So the first bit of advice is you set up a schedule that you plan to stick to come hell or high water. The wake up time is really more important than the bedtime. The bedtime is sort of just anchoring it a little bit, but the wake up time is like what you need to stick to no matter what, even on
Interesting.
weekends, which sort of sucks.
I was about to ask, yeah, I've heard about social jet lag, which is, I guess, what people call it when you sleep in on the weekends. And so, if you, is that the term you use, Jill?
I sleep in on the weekends all the time. That's like my guilty pleasure. Um, I always tell people if it ain't broke, don't fix it. I do have Sunday night insomnia because I sleep in on the weekends. At this point, it's not so bad where I decided it's not worth it. But I know I'm doing that to myself, right? It's a choice. So when
Mm.
people are seeing me when sleep is a huge rip roaring problem, I tell them to be really rigid with the sleep rules. Once their sleep is improved, they can maybe get a little loosey goosey, but then they're aware of it, right? And they know they can tighten up again if they've gone too far. So yeah, so when they're seeing me for sleep, I tell
Hmm.
them, yes, do as I say, not as I do. Wake up at the same time, no matter what. Down the road when your sleep is better, you can make decisions about that. But right now, we want to strengthen your circadian rhythm.
Okay, so step one, set up a schedule and make sure you wake up at the same time,
Wake up
roughly
at the same
every
time.
day. What's
And
what's the
then
next
and then
thing that
your
you would
bed
have them
and
do?
and your bedtime again should be like reasonable, like between 7 and 9 hours, and not going to bed if you don't feel sleepy, which is the next part, which is that you should use the bed only for sleep. the exception being sex. But you shouldn't use it for lying awake and being frustrated. You shouldn't use it for thinking about what you have to do tomorrow. You shouldn't use it for reminiscing about past stressors or thinking about the news or anything that's going to keep you awake. Like the bed really needs to be keyed, linked to sleep, falling asleep and staying asleep. And that's actually like a classical conditioning kind of an intervention. So I don't know if you guys remember, like in sixth grade science class, learning about Pavlov's dog.
Huh?
Have you
Yeah.
heard that?
Who
That was the
drool
dog.
when they ring the bell.
Yeah,
Yeah.
yeah. So
Uh-huh.
what happened was they gave the dog meat powder and they rang the bell at the same time. And obviously the meat powder made the dog drool, but after a while the bell made the dog drool. So we want the bed to make you fall asleep. Like we want to set up that same contingency.
Hmm.
Hmm.
So yeah, so the rule about like no TV in bed, no phones in bed, right? I mean, and there are times that we'll tweak it a little bit. Like I have, right? I said like it's okay to have. I mean, I let couples have pillow talk in bed too,
Hmm.
but like let's say somebody's not sleepy till midnight, the other person goes to bed at 10, right? So if you're going to lie in bed and have pillow talk with your partner, um, it's time limited. You're aware that you're not going to be falling asleep. Like your intention is not to sleep, it's to be, you know, intimate and connected. And then you get out of bed until your prescribed bedtime,
Mm.
whatever you think is a reasonable.
So I get it, no screens in bed, but really no books either? Like, I
No
love reading
book.
a chapter before going to sleep.
Well, so again, if it ain't broke, don't fix it, right? I'm not
Okay.
like, but if you're having sleep problems, right, you want to make sure that the bed is all about falling asleep and staying asleep. So, I mean, if that's part of your sleep ritual and it's working for you and you read your chapter and you fall right to sleep, like, why would you ruin a good thing? If I read a chapter before bed, I want to finish the book. It is not a choice for me.
You've got to
I,
read more
I
boring
also have
books.
that as part of my sleep ritual. I like to read novels before I go to sleep. But not the news. The news is earlier because if I read it right before I go to sleep, especially these days, I will
Hmm.
not sleep well. So,
So the third rule is about like winding down before bed. And we do need that time. I usually encourage that to happen outside of the bed and not in the bed. Like I am all for reading novels, playing games, watching TV. Though some people are very sensitive to the lights from their electronics. Some people
Hmm.
cannot. In fact, I met somebody who could play games on their phone, but even if they went to something as big as a tablet, it would override sleep for them. So not everybody should be on an electronic device before bed, but it seems to be like an individual, like you have to just sort of explore what works for you.
Hmm.
Um, but I'm all for like doing things to wind down before bed. There is no way we can go right from our busy day to falling asleep without some sort of a wind down period. And like I have a guy who has this horrible, terrible work schedule. And he like literally tells me he has like 7 minutes where he gives himself to wind down. I'm like, yeah, that's why you're not sleeping. But he has this horrible schedule and he's trying to cram sleep into this little bitty amount of time that he has for sleep.
Oh, poor guy.
Yeah, it's like that, and he's quite a bit younger than all of us. So I mean, he has a little more resilience, but even like we need time to wind down. Like that's not that like his goal is not reachable, and I was really clear with him about.
mm,
Hmm. So when you say you're really successful when a patient comes to you with sleep problems and it only takes like 4 or 5 sessions, yeah, what do you do with these resistant people who are not willing to change their habits?
I mean, you can lead a horse to water, but you can't make them drink. I mean, I can't make somebody do something that they're not willing to do.
Hmm. Hmm.
We talk about, experimenting with a change. I mean, if it doesn't work, obviously I'm not going to insist that they continue. Um, But if you don't make a change, nothing is going to change. So I mean, I all I do is try to help them decide if they're willing or not. um, and I guess when I said that, it just made me think I was a little bit misleading. Like, so I said, like, oh, if it doesn't work, I'm not going to make you stick to it. But with sleep, a lot of times, like, you have to use a lot of strategies simultaneously. Not any one specific one is going to work. And so sometimes I do make them continue. Like they'll be like, but I took the TV out of my room and it didn't work. And I'm like, okay, but now we have to do this too. You can't TV back and do this. Like you have to add to it, not so sometimes I do make them like keep doing things that they feel like isn't going to work, because we're hoping like overall the cumulative effect is going to balance it out.
Bossy
Sometimes I,
psychologist.
I get insomnia, like I fall asleep too early because I'm on a medication that makes me sleepy in the evening, and then I wake up at like 3 a.m. But I've learned that if I get up, the worst thing to do would be to get up and like make myself a sandwich or something. Like that would really like get all like my brain moving too fast and stuff. So lately I've been just like I kind of meditate a little bit, and I do this like meditation routine that I do once a week in the park, but I do it for like a few minutes and usually I fall asleep. Maybe I'm jinxing it now. Hopefully it will still work after I'm
No,
like
it's
talking
that's
about this out loud, but
Yeah. So I mean it's really normal to have awakenings, and as we get older, we have more awakenings at night. Like a young person, like my college age kid, she might have awakenings at night too, but hers are so brief that she might not even be aware of it. They call them micro awakenings, where you roll over, you're back to sleep, you didn't even like it didn't even connect with you that you woke up. But as you
hmm
get older, you have more awakenings and your awakenings are longer, and coming up with strategies to go back to sleep makes sense, right? And you want to help your circadian rhythm think that it's still nighttime. It's still time for us to be sleeping. So you want to keep the lights really dim. You don't want to be like moving around a whole lot. Yeah, you want to, right? This is a fasting time for us. That's part of circadian rhythm, is that we're fasting during this time. And
hmm
so, I mean, if you eat, it's going to have an impact on your blood sugars, and we don't really digest the same way when we're sleeping. Um, and so you can have more GERD, more like stomach acid working its way up. And so, yeah, so you want to have like, what can I do to kind of trick myself to like going back to sleep? Like, and I think meditation is lovely. Anything that calms down your nervous system is lovely.
But
Um,
yeah, what do you do about these? If you wake in the middle of the night, at what point are you saying, okay, I'm not using this bed for sleep, I should get up,
yeah,
versus I'm hoping I'm going to fall back asleep?
Yeah, I usually tell people, like, if you're up for more than 10 or 15 minutes, it's probably time to get out of bed. But honestly, like, if like, you could be up for 1 minute and you'll know if you're not going to fall asleep quickly. Like, I mean, I've had that where I'm just up and I know I'm up. I don't have to wait for 15 minutes to know that I'm not falling back asleep. You might as well just get out of bed. But for sure, like, you don't want to lay in bed for 20, 30 minutes. Like, you want to be up before then. That's just frustrating to be lying in bed. And the other thing is, if you're going to sleep early, like you said, you're falling asleep earlier than you want, Michi. So if you're going to sleep early, you might not need to sleep as late. And if you kind of force yourself to sleep longer hours, like I said, most adults need 7 to 9 hours. So if you're getting your 7 hours by 3 in the morning, the idea that you're going to go back to sleep might not make sense, or it might thin out your sleep. Like you'll get your 7 hours, but it'll be like 7 hours during a 9 hour period, and then that means you're having a lot of awakenings. It's not as like, people tend to feel more satisfied with sleep if it's in a nice consolidated chunk than if it's like
okay.
thinned out.
Yeah, that doesn't happen to me every night. It's maybe like 3 nights a week or something. So,
But I mean, if you can get yourself back to sleep, clearly you still are sleepy, right? I'm just saying, like,
yeah.
like a lot of times, remember at the beginning, I was like perpetuating factors. Well, when people keep themselves in bed longer and longer in the hope that they're going to sleep more, in the long run, they just thin out their sleep more. They don't get more sleep. They get more fragmented sleep, less consolidated sleep.
How
Yeah.
interesting. I wore like one of those like sports watches for a little while that tracks your sleep and gives you a little graph of how you're sleeping overnight. Do you think those are valuable?
Um, I'm not a huge fan, to be honest, because a lot of times people get really anxious about their sleep, and I feel like that adds to the anxiety. Like they're
Totally
looking.
felt that. I totally felt that. And like, and I sleep pretty well. And I was just like, oh my gosh, I don't want to know.
Yeah,
Yeah.
and honestly, like when I work with people on sleep, like we're not really working on how many hours they're sleeping. We're working on like how good are you feeling about your sleep? Like it's more subjective anyway. Like I don't care if they slept 7 hours or 8 hours or 4 hours, right? If they're feeling rested and restored, like if it feels to them that they're getting a full night's sleep and they're waking up and feeling great, then that's what counts. Like what the watch says isn't really as important to me.
Right on. Brains over technology. I'm into it.
Yeah,
I mean,
all
I'm not
this
going to
like
say it doesn't
continuous
work for
feedback.
anybody, right? Like people are very attached to their smart devices, and if you feel like it's again, if it ain't broke, don't fix it.
Okay, so my next question is, what do you think of like sleeping pills? You know, the various different types of sleep aids that are out there.
Yeah. So, as a psychologist, I mean, I'm not a prescriber, so I never tell people to take or stop people from taking their sleeping medication. Um, I can tell you that there are people who come to me with the goal of coming off of their sleep medication. And if that's a goal, we're usually pretty successful at that. It doesn't seem that most people need sleep medication if they're working really well with sleep strategies.
Hmm.
Um, there are some sleep meds that I think are probably less problematic than others. Like there are some sleep meds that, like I'm thinking of like trazodone, which some of my patients are on, which is like an old antidepressant that they don't really use for depression anymore because it zonked people out and made them sleepy.
Okay.
But they do use it at night sometimes in lower doses than antidepressant doses to help with sleep. And like from what I understand, and again, this isn't my area of expertise, but from what I understand, like that doesn't get in the way of sleep cycles as much as like some of the medications that you hear about that are more like modern and advertised on
Like
television,
ambient
which
type of things.
yeah,
Yeah.
which I understand like can get in the way of sleep cycles. Some people feel like they're less effective over time as well.
Mm.
Do
And then
you
on the
have
flip
any
side, go ahead.
do you have any advice for really elderly folks? Like I live next door to my 87-year-old dad, and he has a lot of insomnia, and oh, he just complains about it all the time. And
Yeah.
yeah.
Yeah. Well, I mean, these strategies work for older folks too. They absolutely do. Um, they're older folks do have more awakenings, right? So they have more, right, more opportunity for insomnia because you're waking up, you have to get back to sleep, right? And they have even more than we do. And they have more, bladder issues and aches and pains. I mean, there's more reason for them to be waking up.
Hmm.
Um, so I don't know that you can like do anything about that, but having like calming strategies to go back to sleep, making sure that the bed is your anchor for sleep, keeping a schedule, being really active during the day can make a really big difference. Like a lot of times this happened with my pain folks too and older folks too. They'll kind of put themselves in the recliner and then
Hmm.
sometimes they'll even end up nodding off unexpectedly in the recliner. Like they're not intending to nap, but
Hmm.
they're bored and they're sleepy and so they do nap. And like that just makes it so much harder to sleep at night. So the more active and engaged they can be, the better. Um, so there's something that I didn't talk about yet that I use for like hardcore folks, and I do use it for older folks too. Um, Sometimes I'm cautious if it's somebody that has a lot of like psychopathology. We want to make sure this doesn't make things worse. But sleep restriction. So
What does
like
that mean?
if someone, let's say someone is only sleeping 5 hours a night, right? And they're, so the first thing that we'll do is come up with like a calming routine, give them, pick a wake up time, right? All the stuff we talked about. But if they're sleeping only 5 hours a night, I'm going to actually shorten their bedtime window. So, like, if they want to wake up at 8 o'clock and they've been going to bed at midnight, like I said, right? But they've been sleeping 5 hours in an 8 hour window. It's like, we're gonna have you go to bed at 3,
Oh, interesting.
and that's painful for folks. Like nobody likes that.
Yeah, why
Oh,
does that
wow.
work?
But
Why does that work?
you're
What
like
happens?
squeezing out all the awakening.
Okay.
Um, so it for most people it takes a couple of nights. It's an uncomfortable couple of nights. I always warn folks, and that's where we get into some of the cognitive part of cognitive behavioral therapy for insomnia. Like we've been talking about all these behavioral strategies, but um, like the cognitive part is like the thoughts that say, but I should be in bed longer to try to sleep more, right? That's a thought, but it's not an accurate thought. Um, so we'll work on like squeezing out the awakenings. And
So,
Oh.
if in an ideal world, this person now is sleeping from 3 to 8 a.m., do they, is that their new normal? Or do they
um,
eventually, are they capable of like going to bed earlier?
right. So they're sleeping, and again, like nobody sleeps. Like when I say, remember I said everybody wakes up, right? So let's say we're putting them to bed from 3 to 8 a.m. We don't necessarily expect them to sleep a solid 5 hours, even that, right? Because maybe you have to wake up and go to the bathroom, right? It might still take 10 minutes to fall asleep, right? Or 15, right? To fall asleep. So it's not going to be like you're getting that solid 5 hours of sleep, but let's say you're getting, almost 5 hours of sleep or 4.5. We aim for about 85% of the time you're in bed, you should be sleeping. So they're getting 85% of those 5 hours. Then we'll really gradually start increasing the time in bed. So we'll have them go to bed at 2:45 and then 2:30, and just sort of gradually up it until they're feeling rested. And, that might happen at 7 hours, but it might happen in 6. Like a lot of times people are surprised that, like part of the problem was they thought they needed so much more sleep than they did to feel restored. And so they went to bed sooner and then their sleep became more fragmented.
Oh,
That
wow.
makes
I
a
mean,
lot of
that
sense,
actually makes
actually.
sense.
Yeah.
What about another question? What about caffeine? Do you
That was
think
exact.
that?
Can I just say I'm researching coffee for a future episode, so stay tuned for what I learned too.
So sad to me because we get so much less. Like I used to be able to drink coffee any time of day. I could sleep. My kid can drink coffee. It's so unfair.
Age is our enemy.
No, like we just become less resilient to it over time. Like so caffeine has like an unbelievably long half-life. Like my brain is probably never without caffeine in it ever because I drink caffeine every single morning. And yeah, no kidding, right? Um
You should come back
so
for our coffee episode in a few
okay.
weeks.
I'll tune into that one for sure. But I usually tell people like at least a 6 hour window, right? So you want to, and alcohol too. Like people think alcohol is, great because it zonks you out and puts you to sleep, and it absolutely does.
No, no,
But
yeah.
it gets in the way of your sleep cycles, and there are folks who like are, you know, like alcohol dependent who will stop alcohol use, and it might take them up to a year to get their sleep cycles back into alignment. So it's a horrible sleep aid.
So caffeine, alcohol, what about cannabis?
Um, so cannabis is harder for me to talk about. And to be fair, I haven't really looked heavy duty at the studies for cannabis and sleep,
I
but
think
I
there's
have.
less studies on cannabis in general
Well,
since it's
and
more.
I have looked at studies for cannabis and pain and cannabis and PTSD, and so far in those in those areas. So I'm guessing it's true for sleep too. In those areas, the studies that are getting good results seem to have, like, I call them like boutique dispensaries. I don't know if they're really called that, but they seem to do like blood work and get a whole bunch of symptoms gathered, and then they combine all the appropriate strains to make this strain of cannabis that is going to work for you. That is not what we see in our dispensaries when we go to get
Yeah.
cannabis for sleep, right? There's like a high school graduate there, maybe not.
Yeah.
This is not somebody who, right? So again, I tell people, like, if it ain't broke, don't fix it. Like, I am not, right. I am not the cannabis police. I don't want to be the cannabis police. But I do think we like using a substance that isn't necessarily designed for that use. Like, I am not a big fan of that. Like I feel like, have fun with cannabis. We know it works great for that, and be responsible.
Okay, so coffee, give yourself at least 6 hours before trying to sleep after drinking coffee. Alcohol, you think it's going to work, but if you do it too much, it's going to take you a year to get back to normal if you stop it and
And
try
the
to
jury
sleep.
is out on
And
cannabis.
the jury's out on
And maybe
cannabis.
down the road, when there's a better, when it's medically distributed in a more thoughtful way.
Yeah, well, I'm sure more and more research will be happening as that
Yeah.
continues.
And again, I'm not like, I don't have a lot of knowledge about cannabis. So I don't want to get myself into trouble if somebody knows more. I believe that, they might very well, and that's fine.
Wow.
So I
We learned
have,
so much today.
we
You
do.
have more questions?
I have one more. My ulterior motive for wanting to learn about sleep and sleep hygiene and insomnia. Now, Jill, you already know this because you're my sister and I tell you everything. But my kid, 13-year-old Godzilla, right? How I've been trying to convince her that kids at 13 need more sleep than adults. They need, whereas I might need 7 to 9 hours, she needs more like 8 to 10 hours. And so I've been trying to convince her to go to bed early enough that she can get 9 hours of sleep before school. This has been a knockdown, drag out fight,
Yeah, good luck with
and
that.
yeah.
I remember years ago when I went to Spain and people would be out like eating tapas and the kids would be running around till 11 at night, and then they wake up super early at 6 a.m. and then they go to school, but then they have the nap,
siesta.
siesta in the
Siesta,
middle.
yeah.
Okay, actually, that brings to mind also, and we've heard about how like medieval people would have like they would wake up in the middle of the night and like eat a sandwich, have sex, and then go and have the second sleep, right? Okay, so all right,
Wait, I never heard of this. What
you
are you
haven't?
talking about?
Oh, you haven't heard about it? I thought this was common knowledge. Okay, so people have discovered that I guess before light bulbs, right, and when people were more just like dealing with the sun rising and setting.
Yeah.
Okay, so here, if you're living in a northern place like England, during the winter, it gets dark by 4 p.m., like 3:30 p.m., and it doesn't get light again until like 8 or 9 a.m. No joke. I wish I was like exaggerating, but I'm not. So if you're just sleeping during all that darkness, that's way too much. And so apparently what scholars have discovered is that people would go to sleep and then they would wake up and do a few things and then they would go back to sleep, and each chunk for like 3 or 4 hours. And yeah, it used to be considered quite normal to have sleep split up that way, which is exactly what Jill here is telling us is not necessarily the best way. Yeah, and
I
then
mean, I
yeah.
can't say that again. Like they gotten enough sleep. They weren't worried about that, right? It was normal. So they weren't looking for it to be any more consolidated than it was,
Hmm.
right? So their anxiety wasn't there. They were getting in enough sleep. It was fine for them, right? For us, we don't have as much time to sleep. We're not like your right, your kid has fear of missing out. Like, right, there's the right, they need to be online till the last possible moment. I mean, and it's true, like with kids too, like their circadian rhythms a little bit different. Like they actually do typically, like if you leave them to their own devices, they will go to bed later and sleep in later
Hmm.
than the
Mm,
rest of us, adults.
Yeah,
So
but they
I
have
mean,
school, so
yeah, exactly. And
true,
it's
true.
horrible because school is
yeah.
usually backward. Like the older kids have to wake up earlier than the
I know.
younger kids, whereas like the younger kids naturally want to wake up earlier. The
Hmm.
teenagers are the ones who want to sleep until, 10 o'clock. So like it's unfortunate that school isn't working with our kids, circadian rhythm, because that is when you're at your best, most focused, right? Is like during the day when you're in your alert phase, right? Not at 8 o'clock in the morning for that test.
Hmm.
Mm.
So you don't have any magic to make your kids
No,
sleep.
I don't. I mean,
Why are
I,
you my
I'm sorry. I
sister?
also don't work. I don't work with teenagers either. So I mean, maybe there are some tricks out there that I'm unaware of. I mean,
Hmm.
I work only with an adult population,
Hmm.
though more and more I'm seeing folks in their 20s. That's been a shift, at least for me lately.
What do you
I,
attribute
I
that
work in
to?
sort of a more rural area, and it's becoming like it's becoming more built up. And so younger people are moving into it, more diverse people are moving into it. So I'm seeing like younger folks now than I used to a couple of years ago. And, it's definitely, it's a different sleep concerns when you're younger, right? Like I said,
Hmm.
I have that one patient who, has horrible work hours, and he's raising a kid, and he like literally, like if he wanted to get enough sleep, he would have 7 minutes of time to wind down, and that's it. So, different issues than our folks in
Yeah.
their 60s
I
and
thought you were going to say young people are more addicted to their screens, but I bet everybody's addicted to
everybody.
their
Well,
screens.
I
Hmm.
have I do have a lot of older folks that don't really use their phones, but they still are having sleep problems. So I think it has more to do with what's going on in your mind, right? And I don't. I mean, our screens, I think, can be really calming and peaceful if we look for that content, but a lot of times it's not what we're seeing, right?
Yeah. Yeah.
Mm, yeah, a lot of people in the US have TVs in their bedrooms also, which is an interesting idea. I was thinking of getting my dad one because for when he wakes up, I thought, well, he can just instead of going to the living
No,
room and
have them
then
go to the living room.
okay, but he broke his hip, so I was like, oh, so he
Oh,
doesn't have to
well,
walk around. But
yeah, there is that. So safety. Okay, so remember I said that sometimes we have little exceptions, right? I had a patient who was spinal cord injured. He had a person who came and put him to bed every night, and it was well before he was ready to go to sleep, right? But that's when he went to bed. And so we worked with intention, right? The same way as the couple that has pillow talk. You work with intention. Um,
Mm.
Lights are on, pillows are keeping you upright. This is not bedtime. When you're ready to go to bed, right? It's a different intention. You're feeling sleepy now. You lay down. You have the covers on. You turn off the lights, right? It's a different intention. So you're right. I mean, it's better if you can get out of bed. Even if you just sit on the recliner next to your bed, like that's better. But if it's not safe, right? Safety is
Hmm.
way more important. And so then you just work with, this is not bedtime. I'm going to be alert and engaged at this time. And when I feel sleepy, it will be bedtime and I will lay down. I will shut those lights. Right? And you talked about like sleep hygiene at the very, very beginning. We didn't even really talk much about sleep hygiene. I mean, sleep hygiene is like, making sure the room is dark and cool and comfortable and that there isn't a TV there and right, like sleep
Mhm.
hygiene are all those like I think of as very low hanging fruit, but for most people with insomnia, sleep hygiene is necessary but not sufficient. Right? Most
Mm.
people need to make additional changes.
I really like what you said about, Pavlov's dog and the bed and just making the bed associated with sleep. That is a new thought for me. And yeah.
We do, condition responses are really a big deal. Like you learn about them and you think it applies only to animals or, like monkeys and dogs and stuff, but honestly, like we create condition responses all the time. Like anytime you are think about anxiety. Like I was always somebody who was very anxious about school, and anxiety became associated with doing well in school. And so like if I don't feel anxious, I might fail, right? Like that's a conditioned response. I remember
Yeah.
hearing about it was um a Golden Girls episode.
Uh-huh.
And I don't remember who it was. I don't think it was Rose, like maybe Blanche. I really don't remember who it was. But one of them was saying how when she was a little girl, the sprinklers would go off at bedtime. And so she always thought that going to bed made the sprinklers go off. I love that example because I feel like anytime our brain hooks things together, right, it becomes like a rule and we have all sorts of rules that just don't work well for us anymore. And we need to make those rules explicit so we can start challenging them, right? That's the cognitive part of any cognitive behavioral therapy is like kind of recognizing our rules that are underneath the surface.
Awesome.
Interesting.
Pavlov's dog bed is going to make us drool for sleep. I'm into it. I'm sure I drool while I sleep. TMI. Well, awesome. I have learned so much, and I am so grateful to just have like new thoughts. Okay, so can I just tell you, we've been thinking, the hairy guy and I, about swapping out the office and the bedroom. So right now, our bedroom is like the master bedroom. It's the biggest room upstairs, and the office where I currently am is a very small room, and we've stuffed both of our little desks and our workspaces in here. But what if we swapped it around and like basically only the bed would fit in this room, and then the office could be like this big space for awakeness and all these, it could that. So I think I'm going to revisit that as a possibility and make the bedroom not the glamorous wonderful space, but the bed and nothing else space.
Ooh, it'll be interesting to see how that works. You'll have to report back.
Well, we'll see if it happens, but yeah, I think I'm going to push that forward.
That
Awesome.
sounds cool.
Yeah. Thank you so much for joining us today, Jill. I hope you'll come
All right.
back and tell us other things that we can learn from psychology.
My
But
pleasure.
now,
This is fun.
yeah, yeah. Awesome. Well, it's sort of the end of our episode, and we have a ritual where we go around and we set an intention for the week. But Miechie, you go first.
Okay, sure. I didn't really have one either, but I was thinking, I'm in this accelerator entrepreneurship competition, and I suddenly got in, and I suddenly need to do all this stuff and find mentors, and I just I have this bracelet I made once that I think of as my love yourself no matter effing what. So that's what I'm going out and talking to people. Some of them are rejecting me. Some of them are loving what I do. I'm talking to so many people about what I do now. So I've, yeah, love yourself no matter effing what. That's my intention.
It's a good motto. Jill, do you have an intention for the week?
I don't. I'm struggling. I have a lot of things on my to-do list and I intend to get those done. Does that count?
Yeah, sure. Yeah, you intend to
I'm
tick off
giving
things
a
on your to-do list.
I'm giving a presentation on Thursday, but I need to get the PowerPoint and objectives and all that stuff to the people on Monday. So my intention is to work really hard on my presentation all weekend. Um, it's on hypnosis and chronic pain. So maybe you'll have me
Ooh,
back for that because I'll be so knowledgeable by the end of the weekend.
That
awesome.
sounds
All right.
awesome. Yeah, we totally want you back for that.
Yeah, yeah, it's a date. Okay, I suppose I should tell you what my intention is now that I've had the time to think of one. Um, so yeah, it's been stressful around this house, and my intention for the week is to keep my cool and not raise my voice. It's always a tough one for me, but I'm going to try to keep that in mind. And with that, that wraps up yet another fabulous and hot episode of Hot Mama's Cool Planet.
Yay!
Thanks for having me, guys. Bye.
Thank you so much, Jill.
Yeah, thank
And
you.
thank you, listeners. And yeah, that was fabulous.
Like and subscribe, people. Oh, yeah, go for it. Like and subscribe. Yeah, do it. Yeah.